Let's get welcome everybody. Before Alice says just a couple opening remarks, I'll just say, please, this is supposed to be conversational. So two things. One, please use the chat throughout the presentation component of the hour. We'd love to hear your thoughts and comments, and also please feel free to introduce yourself there. Second of all, once we start getting into discussion mode, we would appreciate that you please raise your hand to get your self-recognized so that we can admit you to speak and ask a question or share feedback or share some information from your own state. We're really, really excited to have Stephanie here and know it will be a great conversation. So Alice, over to you for any introductory remarks.
Well, those were great introductory remarks. I'll just add a few things. Hi, everybody. This is Alice Bonner, chair of Moving Forward. Isaac and I lead this work across the country, and we're just delighted to have Stephanie here from Texas today. And Stephanie, not only, as you'll hear, is doing work in Texas, but policy work that translates across states as well. So we're glad to see lots of people from many different locations here. I see New York and Ohio and other places. And we have a really nice, and Connecticut, thanks, Andrea. We have just a really nice group of folks with different backgrounds. We have researchers, we have GWEP directors, geriatric workforce enhancement programs, we have HIT experts, we have nursing home residents, and many others. So please feel free to chat in your name, where you're from, who you work with. And with that, I think we're going to just have Isaac introduce our guest speaker, and then we'll go from there. So Isaac, back to you.
Awesome. Thanks, Alice. So this is a really exciting session for me. Stephanie Allred and I spoke some time ago for the first time, probably over a year ago, along with Mark Unruh and some others who I see Mark on this call. We were looking into different state policies around licensure and management of ownership data within the state licensure agencies, as well as within Medicaid agencies. And we were reaching out to different agencies to learn about how they were doing this work, where they were having challenges, and innovative things they were doing. And Stephanie was probably the first person I got to talk to about it in her work in Texas. And it just really kicked off my whole understanding of this issue. It's really a pleasure to have her here. But without further ado, I'm going to give a little introduction to Stephanie. So Stephanie is, was the director of long-term care regulations, licensing, and credentialing. And we are really excited to congratulate her for recently becoming the Deputy Associate Commissioner of Licensing, Policy, and Training in Texas. So really, doing great work and moving up in the world. So congratulations to Stephanie. She obtained her doctorate of experimental psychology from the University of Texas at Arlington with a major in cognitive psychology and a minor in statistics. Her focus of study was in ambiguity in the English language. She began her career with the state as a professor at the University of Texas at Tyler, teaching various psychology and statistics courses. Following, she worked for a state-owned psychiatric hospital for 17 years. Her positions at the hospital varied from data specialist, director of training, standards compliance officer, to director of quality management. Currently, she's the not anymore, we talked about that, but she works at Texas HHS. She is responsible for the provider licensure and certification of over 13,000 providers and credentialing of over 140,000 individuals. And she's here today to talk to us about what it means to create clarity in nursing home policy, especially in the realm of ownership data management and certification of direct care workers. So Stephanie, thank you so much for being here with us today. Really excited to talk about these issues with you and learn from what you've been doing in Texas.
Well, thank you. I appreciate the invite to come and talk to people. I love sharing all that we're doing in Texas. I'm a big believer in don't reinvent the wheel. If anything that we're doing speaks to you and you want to borrow it or take it or talk to me about it, please feel free. So let's start with our slides. All right. Well, I am going to talk to you today about two projects that we've done over the last year or so. Some of them even longer. One of them is a little sooner. The first one, next slide, is an ownership project. Let's go to the next slide. In long-term care regulation in Texas, we license 6 provider types. We have nursing facilities, day activity health services facilities. In some states, that's called adult daycare, assisted living facilities, intermediate care facilities for individuals with intellectual disabilities, prescribed pediatric extended care centers, and home and community support services agencies that do home health and hospice. And as you can imagine, all of them have different definitions in this statute and the rule state-wise, also different definitions for federal components in the federal statute, the federal rule. So next slide. So what it did is it led to confusion. All of our providers, because we have providers in our state that have multiple licenses, they do multiple things. And so for one license, they would have one definition. For another license, they would have a different definition. We would have different definitions for licensure than we did for Medicaid contracting, the contract associated with the license. And so this led to confusion, not just for our providers, but for our staff, because the staff have to know, and they handle multiple license types per unit. They have to know which ones are disclosing the right information. So what this usually meant is that providers overshared. And once they share it, we have to process it. For every person that's shared, we have to do background checks. We have to do screening on them. For every legal entity, there's additional screenings that are done. And so we wanted to help our staff and our providers understand what we're doing. So next slide. So we started this project in 2019, and yes, that is the correct year, 5 years ago. We started trying to create common definitions, and we had a goal that this project would lead to the common definition for licensure and Medicaid contracting in Texas for owners, controlling persons, and affiliates. So next slide. So phase 1. And I will tell you that these phases are retroactive. We did not start out with, we're going to do phase 1, 2, and 3. We started out with a work group that said, let's get together and talk about this. And so we got all the staff and legal, each section within Health and Human Services in Texas have their own legal representation. So we got all of us in a room. Back then we were in rooms as opposed to on Zoom calls. And we started reviewing all the multiple different definitions, with all the laws and all the rules. This part of the process took a whole lot of time. To make that a little bit more complicated, the longer it took, the more personnel changes, particularly with our lawyers, created new interpretations of the rules in the statute. So that led us down different paths and different ways of looking at, particularly who's a controlling person. So next slide. Well, once we reviewed all of the different definition, we all were on the same page of what it all said. Now we had to create a common definition. We had to be in agreement that the definition we created covered all the requirements for everyone. And this led to many, many meetings, many emails, staff at all levels, from the frontline staff all the way through our leadership in both divisions, to make sure that we all agreed that this was the right definition for everyone. Next slide. Well, I will tell you that last year we thought we were done, and I actually provided information that we're so close. And then the federal government decided to change their federal requirements related to nursing facilities. and the ownership of nursing facilities. And that went into effect in December 23. And so we had to reevaluate. We had to update our definitions to include that information. For some of those requirements, we put it in our definition, and you'll see if you look at our document that is available publicly, that we put that information in there, but there's some of them we cannot collect information on yet. It takes time for our online system to be updated to collect the information that is beyond the just adding, these are the people you list. Specifically, the real estate owners, and we always looked at real estate, the legal entity that owned the real estate, but we never looked at all owners who had 5% or more ownership. And now that is the new requirement. And so we will have to update our system to collect that information. Next slide. So once we finally all agreed, we had it all written down. Now we had to publish it. We need to let the providers know, in addition to training our staff, but we wanted it available publicly before we used that documentation to train our staff. This new letter has been published. It's on the HHSC website, and I put a link in this, and I have provided this PowerPoint to be shared with everyone. So you will have those links as well. But it does go through exactly what we mean by owner, exactly what we mean by controlling party, and exactly what we mean by affiliates. So next slide. Now, we've had some expected benefits of this. You know, the providers have a better understanding on who they're to disclose. Our staff have a better understanding to determine if they are disclosing appropriately. Licensing and Medicaid contracting have a common definition. It reduces conflicts, because we were having our partners in Medicaid contracting would say, you're not disclosing what we need you to disclose. Go back to your license and disclose it for them first, and then come back to us. And so we've cut down on some of that conflict between our two divisions. I got feedback from one of our stakeholders. He said, I provided this document to our legal department, who said it was very helpful. And that is probably one of the better compliments I've heard in a while, so that we were helpful in providing clarity. So I was very excited to get that feedback. Next slide. Our next step, of course, is to update our system. But we're not only going to add the additional requirements. Our plan is actually to update our system in a more user-friendly format. We implemented the current licensing system in 2018. However, when we did it back then, we basically took the paper application and put it in the system verbatim. We have since realized that we can make a more user-friendly format and take advantage of the technology that's available to us to make it simpler. And the expectation is that project will start next year. So we are looking forward to making it easier for everyone. Next slide. I'm going to go into the second project. It's a little bit kind of it all fits together for us. It's all about how the licensing process works, because ownership is one piece of the overall process. It's a big piece, but it is just one piece. And so next slide. In addition to the 6 provider types that we license and certify, we also credential nursing facility administrators, certified nurse aides, medication aides, and nurse aide training and competency evaluation programs. In addition, for nursing facilities in Texas, they have to have an allocation of Medicaid beds in order to receive a Medicaid contract. And those allocation of Medicaid beds are associated with their license. And so it adds a different process to the overall, how do we get to the point where we can get our money? And so we decided that we needed to map these processes to make them clear and help give us a tool to communicate with our providers about how things work. So next slide. So the goal was, of course, how do we clarify all those many, many confusing steps to get to a license? And to beyond that, the license is the base for the Medicaid contract in Texas. So how do we get there? It was to provide an overview of pretty much every process. And when I say every process, I really do mean it. And ultimately, for all of these provider types, we created 88 process maps. And so we're going to concentrate today on nursing facilities, but there are a lot out there that can be used by anyone who wants to use them. Next slide. I will say that one of the last slides in these presentations are links to all the process maps we've made publicly available. So you have access to pretty much everything we've done. There are some missing on there, but I will tell you how to get to them because we've done some more since I sent in this presentation. So next slide, please. Okay. This is kind of as these are not necessarily links. Some of them are screenshots, some of them are links, but the full links are in the back in the last page. So you will have them. But this is kind of what it looks like on the nursing facility, how to become a nursing facility provider page. We created different maps for different parts of the process. You know, there's an initial, how do I become a nursing facility? Of course, if you are a hospital-based nursing facility, it's different because you're associated with the hospital. So they have their own map. How do we do renewals? How do we do change of ownerships? How do we relocate? How do we do temporary closures? And that's different whether you are a Medicare certified or not, because Medicare has their own process to incorporate with ours. For Medicaid bed allocation, which is that allocation of Medicaid beds before you can obtain a Medicaid contract, this is the process. There's maps on how that works as well, because there are different waivers and exemptions that allow you to obtain Medicaid beds, because officially in Texas, there is a moratorium on new Medicaid beds within the system. But there are processes, waivers, and exemptions to that moratorium that allow people to obtain the beds or increase their beds so that they can provide those services to those who need it. Next slide. This is a screenshot of what the nursing facility initial looks like. And I'm going to kind of give you kind of how it works so you can understand how to read them. You will see a common theme through them all. They all kind of look like this because they are all very similar, so that once you learn how to read one, you can read them all. Of course, we start on the left with the application submission. We have to have an application in our online system before we can start the process. Once we get the application and payment, it's assigned to a specialist, and then it goes to the next column. It goes under review. Now, we've got a couple little ones on here because we try to work with our partners in Medicaid so that we can have connection points that help our providers. So you will see that the specialist is going to send an email to CAPM, which is Contract Administration Provider Monitoring in Texas, and they're going to let them know that we got an application so that they can start their process with them at the same time. So they can start collecting data for the contract so that we are working in parallel. Of course, they'll review it. They'll do if there's any deficiencies. And it also goes to our screening and analysis unit to do background checks, other screenings, financial analysis, all the things we have to screen for them to be a nursing facility. And of course, they'll go into the Aspen, the federal system for nursing facilities, and create an account there so that that's where the surveys will be documented. And so once they've gone through all of the application piece, they'll move into the life safety code survey. Of course, the provider has to say they're ready. And then we will work with our partners in the regions to get a life safety code survey scheduled. And then they can, once they have a successful life safety code survey, they can, in Texas, they can admit 1 to 3 individuals. Once they do so, they let us know that they're ready for a health survey. Then we work with our partners in the regions to schedule a health survey. And once they have a successful health survey, we issue a license. Now, on top of that process, my staff also handle the Medicare certification. So we put that process on here as well. so that we work in conjunction with the Medicare administrative contractors, the MACs, in order to do this process, because the applicant's going to submit their 855A, the application, to the MAC, and then we will work with the MAC to get your ultimate approval. And then we're going to let our Medicaid partners know that you have your Medicare certification and they can move forward with their part of the process. I know that's a very quick overview of this, but this gives you the overview. Now we have instructions and other things that give them details, the rules and whatnot, to give them more details on these things, but this is how it works for us. And so everybody can almost check off where they are in the process as they go through. Next slide. Now, Medicaid bed allocation is different because it's prior. There's a piece that is prior to the license and a piece that's post licensure. So prior to the license, they can request things like a community needs waiver. They see a need in a community, in a county, for Medicaid beds. So they can ask us for Medicaid beds, and they go through this process. And then they start building. So it is prior, not only prior to licensure, but it's prior to them building a new nursing facility, so that they will know that they have an allocation of Medicaid beds, that funding stream is available when they go through the process. And when a nursing facility closes, just as an FYI, is kind of interesting, they don't automatically lose those Medicaid beds. They can put them in what's called replacement status for the construction of a new nursing facility, because we want the nursing facilities to be as new as possible for our constituents, for those who are being served, and that it's continually moving forward in Texas. Next slide. Now, we did our providers first. And then we came back and thought, and this was at the beginning of the year. We posted those, I believe, in sometime in the spring. Then we came back and thought, you know what? We need to do this as well for our occupational licenses. We need to be very clear on how to become a certified nurse aide in Texas. Because until we got into this, there are actually 9 routes to become a certified nurse aide in Texas. And so depending on your own personal situation, you may go through a different process depending on as we go along. But we decided that for occupational licensees, that it needed to be different than what we did for providers. For providers, we just did the map because they go through that process periodically. They know how to work that process. For occupational licensees, these were individuals, and they needed more narrative explanations in addition to the maps. So we created different things for them that we did not for our providers. Next slide. And this is what it looks like on like I said, you'll have a link to this at the end. But for each one of these, these are the 9 routes of becoming a certified nurse aide in Texas. We put them in little umbrella things so that when you draw accordion, when you click on it, next slide, it gives you the narrative on exactly what you have to do to become, through the traditional route, what you need to do, and links to things that help you get to the right place to become a certified nurse aide. But if you click on the process map, for those who are a little bit more visual, next slide, we actually gave them a map that takes the narrative and puts it in a more visual form so that they can check off where they are at the same time. And so it gives them, the traditional route is probably it's the longest route. You have to do all the things. But, we have waivers for if you're a graduate student of nursing. We have waivers for if you military personnel, if we have reciprocity if you come from another state and you're already certified. So there are you know, this is the traditional route, but there are almost like exceptions to this route that will get you through the process quicker. And that's what the other routes are. Next slide. There's actually 4 options to renew a nurse aide certificate in Texas. Had no idea that we were quite so complicated until, but now that we're telling everybody this is exactly how it works for you. You have to figure out which one of these is your option. And once you find your option, here are the steps. And so, but if we open one of those options, it will tell you at the top, this is for this situation. Next slide. I can't remember if I put that specific in there. Option 1 is the traditional. You submit the application, you go through the renewal process. It's the others that say, okay, if you meet this, you can do these. All right. Next slide. I did on my little process map, we put a little bit of verbiage down at the bottom for them for each of the maps so that they have a little bit more information. Next slide. So when I sent in this presentation, our next steps were we were going to finish. Since then, we have finished. All of these process maps for medication aides and nurse aide training and competency evaluation programs are out on the website. They're all available. The nursing facility administrator ones are all out there. I will tell you, when you go to the links on the end, let's say you go to the nurse aide one, it will get you into the website. If you use the search function and search for medication aide, you will get to that website, and there will be a how to become a medication aide in Texas, how to renew a medication aide in Texas. So it's the links I've given you with the search function will get you to everything else I didn't put a link in there for. Next slide. Oh, I'm done at the end. Now we're open for questions. I'm hoping there's lots.
Well, thank you, Stephanie. That was phenomenal. And Isaac, thanks for advancing the slides. And a couple of thoughts from me. Wow. So my head is like ready to explode right now because you've given us so much information. But I think, you know, for me, and again, we've worked with lots of different states, and there's a bunch of people on this call who've also worked with lots of different states. It's still remarkable to me every single time how complicated this is. And I think you've done a beautiful job explaining how you've tried to streamline and simplify as much as you can within the constraints that we have. And I think that's really important. We cannot say to one another, oh, this is just always going to be complicated. No, it doesn't have to be. We can do something about it. And you're an example of having done that. So thank you so much. We've got a great combination of people on the phone today. I'm hoping a couple of the folks will chime in. And I might start with our senior program officer, Dr. Jane Carmody, who's joined. And Jane, I would just say, do you have any initial reactions or thoughts? I know you and the John A. Hartford Foundation work with lots of states on these issues. So just any comments that you'd like to make to sort of kick us off?
Well, Alice, thank you so much. And I'm sorry I was a little bit late, but I was just in Dallas. Tuesday and Wednesday. So, I would agree. Complicated, difficult items and regulations, and you really made it sensible to me, which is hard, you know, to do. I did have a question, Alice, if that's anyway. The foundation is privileged and pleased to support this work, and thank you so much for being here. But I do have a quick question, Alice, or do you want me to wait till?
No, go for it. Go for it.
So it seems to me that there's a large, and you know them, Alice, Lori Porter has a group of association of CNAs, and they are also looking at a certification. And I thought they were doing it in Texas. Is there any relationship overlap or anything around that, Stephanie?
Well, I believe Lori was, she does other things as well, but she was doing a nurse aide training program. And I believe her program is called NICE. And she was a nurse aide training program in Texas. her model is a little bit more complicated, and it's very good, but it trying to fit in with the current structure in Texas is a little bit, because it's all virtual. And so it's a little bit different. But yes, we've worked with Lori on multiple things, and I saw a little chat thing that came up, the Gay Core Association that she's part of.
Yeah, and I would also say, Jane, I just talked to Lori a couple of weeks ago too, and we do really want to stay connected with NACA. They have some great programs. Some of them are newer, and so they're innovative, and there's things to work out. But I think there's a very dedicated group there. I know Isaac has a couple of questions, and then I thought maybe we would turn to Nancy or Marguerite or some of the folks on the call who are nursing home residents and may have some things to share as well. So Isaac, over to you.
Thanks, Alice, and thanks, Stephanie, for that wonderful presentation. I do have a few questions, and I'm hoping it'll start to kick off some thoughts for others as well. The first one is about the first two are really about the process you guys went through as you did this. And I would say the first one is related to the mapping exercise. And that's as you went through the mapping exercise, both related to the licensure process and the certification process for direct care workers. Were those was the mapping an easy exercise, and that you sort of kind of knew as internally what the processes were pretty clearly, and you just needed to get them out on paper for other people to see? Or was there a layer of fact finding that you had to do internally where you're like, oh gosh, I don't know if we have 9, 10, or 6 of these like CNA routes, and we have to sort of figure out what's going on internally first?
Well, yeah, for the internal mapping, you're right. Our frontline staff knew it all. They knew that there were 9. But us trying to get it on paper so that everybody could understand exactly which piece fits where, it was more of and in both cases, I think you need a champion. You have to have someone who is vested in the process and wants to keep it moving forward, because people are going to get tired. They're going to get lost in their day-to-day jobs, just trying to get all those licenses issued. But we would pull them off of that every now and then and say, no, let's review this. Let's work on it. Let's make sure we all understand exactly, so that we can help others understand. And I will tell you, it's interesting for the ownership project. Texas Health and Human Services has a nursing facility change of ownership committee that pulls together everyone across the agency related to a nursing facility change of ownership. Who touches it? And so I am a co-chair of that with our partners in Medicaid, and we are working on mapping that process across the agency, from licensure, certification, Medicaid enrollment, Medicaid contracting with the NCOs. We are working on that now. And as you mentioned, we all know our own, but we need to work together. And where's the touch points? And we are working on that now, actually.
Thank you. And my second process question for you is sort of about, I think, a little bit of that relationship with the Medicaid agency, which you started to touch on there. When you guys were working out some of these common definitions and working on this provider letter, can you talk a little bit about the dynamics of working across agencies and how you were able to sort of build the necessary relationships to do that, and perhaps where maybe some of the sticking points were along the way?
I think Texas Health and Human Services is in a unique position because we transformed again in 2017, and they merged some of our different component agencies into Health and Human Services. Well, that brought us all together into one agency, and we began to build those relationships. We began to build, where are the touch points? Who does what functions? How do we work together? And so when I started this project in 2019 for ownership, I'd already started building those connection points and was able to bring people in. And as we went along, we brought more people in. what about this section? What about these people also work with this same process that we're looking at? So let's bring them in. Let's get more voices, bring everyone to the table and work on that. Every now and then, of course, you know, we had different definitions. Nobody wants to give up their piece. And particularly if it's rooted in statute, federally or state, you can't. And so we had to work together to figure out, how do we make this definition work for everyone? And it took us a lot of meetings and a lot of discussion and a lot of research and to get through that process.
Thank you. I'm going to turn to Nancy because it looks like she has a question. Nancy, are you able to yeah, there you go.
Yeah, I just got the prompt to unmute. Thanks, Isaac. Thanks, Stephanie. I have two quick questions. One, were residents involved, and how many residents were involved in this work with you? And then also another question is, I just jumped in a little bit late, but I heard the word transparency a couple of times in the beginning. When there's self-reporting involved, you know, we already know that there's a quite a bit of dishonesty when it comes to self-reporting data and documents and facts. What is the process for, does an administrator have to like submit documentation that supports, you know, what is filled out on certain forms or that kind of thing?
Well, I will start with the residential piece, and that is a very good point. We did not include nursing or different residents from our different license types. We did work with our associations who represent and different advocacy groups so that they were aware, and we got feedback on our process maps to make sure, because we wanted people to understand. And so we tried to work with those who represent the residents to make sure our processes were good. In terms of self-report, that is not specifically under my purview in Texas, but I will tell you that we did implement in it's called TULIP. It's the Texas Unified Licensure Information Portal. And it is a comprehensive system. We make it more comprehensive every year. And we did put our complaint and incident intake, our self-reports in that system about a year and a half ago, approximately. And I think that might have we also kept of course, our phone and our ability to email and all of those other options, but it gave a system they're already in, they gave them the ability to report right there and to submit information right through that system. And I think that may have helped them a little bit, give them more options in terms of reporting. Of course, you know, we always encourage our residents and those care providers and anyone to report anything to us through our complaint and incident intake process, so that we know, and that as a regulatory entity, we can look into everything that comes to us.
That's great. Thank you so much. Thanks, Nancy, for always the good questions. So, you know, I'm wondering again, as you know, Stephanie, we've done a fair amount over the last 2 years with a lot of the people on this call on nursing home ownership data and transparency about who owns nursing homes. You referenced that a few times. And certainly when there's a change of ownership, that's a particularly vulnerable time.
Yes.
You know, a lot happens during that time. I just wanted to ask if some of the people who've done some of that work, again, I know we have Dr. Mark Unruh on the call from Weill Cornell. We have Kim Hodges from NASHB, which is one of the national policy groups. Just any thoughts or comments, Mark or Kim or anybody else who wants to unmute and speak to this. We have Sean Sloan from CSG. These are all groups that, you know, have taken this on along with many others on this call. So I don't know, Mark, thoughts given what Stephanie and the team is doing in Texas? There
Sorry,
you go.
to unmute. Can all you hear me?
Yeah.
Yes.
Okay, great. Yeah, that's a big challenge in our research. I do a lot of work on ownership structures of nursing homes, particularly private equity and real estate investment trusts. And yeah, it's always a challenge when you look, for example, just using the CMS data as an example. A lot of those owners just aren't there; they aren't listed. And so, we have to go great lengths to try and identify them. So we do that using these proprietary databases that are typically used by financial institutions for investment purposes. And it's a very long, laborious process of pulling all that information out and then trying to link it to an actual nursing home and so on. But one thing we found when we brought this up with other states and also with CMS and the Center for Program Integrity is there just doesn't seem to have been a good way to audit this data. It seems like most places don't have the resources to do that sort of forensic accounting, and it's an issue that's come up over and over again. I don't have a solution to lay out here, but just sort of laying out what the problem is, which makes it awfully difficult to identify those who are actually responsible for what's happening in the facility a lot of the times. And there can also be, just because there's a name of a company or corporation listed, it's often very difficult to find the individuals behind that entity.
That is, I completely agree. We are, one of the things that when we update our system, we are going to start asking, is this legal entity a real estate investment trust? I mean, we're going to start asking the questions when we update our system for every legal entity that's listed. So I'm hoping that in Texas, we will have the ability to data mine that a little better going forward. But you're right. It's interesting because, we have corporations who own many nursing homes in Texas, but they put each license under a different legal entity to limit their liability. And so it's interesting trying to figure out how to determine how they connect and how do we know that and how do we use that information moving forward. I agree.
Yeah, and the first step is collecting the information, right? Then once you have the information, it's like, okay, how do we act on this? And
Right.
Again, to Mark's point, moving forward, Coalition has literally been approached by state leaders in states that have said, we want to do a better job. We know we're missing this information. Can you help us just sort of figure out how to do this? And then, so the will is there. It's just, it's not a small thing, right? It's changing state systems. And so that takes some work, but to Mark's point,
It does.
behind this, yeah.
So we have a question in the chat, but before we go there, just to kind of connect the dots here a little bit, in terms of sort of how important is definitional consistency across Medicaid and licensure to doing the sorts of oversight work we're talking about well? Is this a journey or of a different work stream and not as relevant to achieving some of the goals Mark and Alice are talking about?
Well, I think that the more consistent we are particularly within Texas, because that is our focus. I do think if we could be consistent across, it would be even better across states. But we have to work in our own house first, and we have to figure out how can we be consistent. Because I will tell you, we were frustrating providers, frustrating them with that, having different definitions and kind of creating this internal conflict. But now that we have standard definitions, we are seeing less of that and seeing less frustration on our provider side related to those conflicts, which makes it easier for them to do the process, which gives them less time to spend on administrative burdens and more time to spend on providing care.
I think that's a great point about, doing it in your own house first, for sure. So thank you. So the question that Isaac noted is, Tuanong said, does the Texas process of declaring ownership of a nursing home detail if the land or building is owned by the entity that is submitting the application and who owns it?
Currently, of course, that will change when we update our system to implement the new federal requirements. But currently, we obtain information on the legal entity that owns the real estate. which will allow us to see if it's the same legal entity or a similar legal entity who owns the operation. It's interesting in Texas that the majority, we're probably between 2/3 and 3/4 of our nursing facilities, the license is in the name of a non-state government entity, like a hospital district or a county or a city. And so that ownership structure is different for them because they are non-state government entities. And so we also collect same information on our management companies. So not only who has the license, but who's actually running the day-to-day. So we collect that. You'll see in that provider letter that it says, not only do we want owners, controlling parties, and affiliates of the licensed legal entity, we want it on the legal entity who is the management company, because we want to ensure that we screen all those people who are truly running the day-to-day.
Right. And a lot of people on this call may know, but there's a lot of management companies out there in nursing homes. So that is really important. I think it's interesting, again, that Mark is on the phone, and he, among others, has done a lot of research in this. So when you say non-government entity, and it could be it sounds like it's out of state, are any of those, do they fall into other categories? Because, I wouldn't know what that is, as a.
Well, they're Texas. They're all Texas. They are a non-state government entity. And in Texas, that is a hospital district, a county authority, a county, or a city. They're government entities in their own right. They're just not state entities.
I got it. Okay. That's helpful. Thank you. That's good. And yes, so those are great explanations. And that was a great question. So thank you, Thwan, because that was a really important. And Nancy said, Mark should be on a loophole think tank to create references to help HHS play defense against loopholers from the get-go through the entire process. Yes. Good call, Nancy. He is one of the national experts, and we've shared his and Dr. Tyler Braun's and others' work with many folks who are interested. What about some of the other people on the call today? What questions do you have for Stephanie and her team related to any of these topics? Ownership, transparency, accountability about these different entities, licensure, certification. Anything's on the table. Jane?
Thanks so much. Alice, I missed the first part, and sorry about that. Did you say how many nursing homes are in Texas, Stephanie?
I did not, but there are about 1,200.
So is that the most of about any state?
With California, right?
Oh, California.
Yes.
I always forget about California. Yeah.
I think they might be tied. It's pretty close.
Yeah. So my question, Stephanie, would be, how, and maybe you explain this, how did you get interested? How did Texas get interested in really looking at ownership? Was it an incident? Was it because you have so many? Or if you could share, I'd love to hear that.
Well, I believe it was me. I became part of long-term care regulation in 2017. And so I began learning because I was on the provider side at a state psychiatric hospital for 17 years. So I came into long-term care as their director, and I thought, I need to understand. I need to learn. So I started reading the rules and started reading the regulations. And I thought, these don't match. These don't make sense. What are we doing? How does staff know? How do we help our staff know first? And so I started talking to the staff, and they were like, well, we get all this extra stuff. We know they don't have to submit that. And I thought, so how do we help our providers? How do we help each other so that we are accurately disclosing the right information, and it's enough and sufficient, and that we are truly screening those we need to screen. And so I started talking to our attorneys and said, what's the difference? What's what do the rules say? What's the federal government say? And they're like, oh, let me look. Let me get that out for you. Let me go back into all that. And we started the work group to move forward, simply because I needed a better understanding.
Right. Well, you're getting a lot of kudos in the chat from me and Jane, and I'm sure others are just nodding their heads. You know, you just took this on because you were curious, because you said to yourself, why are they doing it this way? This makes no sense. Or maybe it makes sense, but I need to find out more. And just pursued something that you thought was really important, and it made a difference. And you got
Yes.
other people together. As soon as you started talking about it, everybody else was like, oh my gosh, she's onto something here. That's how change happens. That's why we have this
Right.
group. We hear from all of you guys. So all of you that are listening to this call, I hope you're going to take some of this back to your own organizations, or you're already doing it. So we say kudos to you if you're doing what Stephanie did, that she's talking about today. And you know, this can happen in any state. It just takes the power of one. It really does. So
Yes.
I'm going to turn it back to Isaac to keep monitoring the chat. I'm going to need to head to another call, but Stephanie, thank you so much. This is great. Isaac, back to
Thank
you.
you.
Well, I think that leads to sort of a next question for you, Stephanie, which is, okay, so you got there, you did this, you've gone through this process. I'm wondering if you can offer some guidance to other folks in a similar position in their state in terms of how they can begin these conversations, what sorts of roadblocks they might run into, and then when they run into them, how they can sort of keep going anyways.
Well, I'm a big believer in the champion model. You got to have a champion. You got to have someone who says, this is important to me. You have to have someone who's willing to bring people to the table and to start asking the questions and to start, working through and be persistent, because, 5 years is a long time for one provider letter. We could have given up years ago, particularly when the pandemic hit and, things got sidetracked, and we definitely had more priorities than a provider letter. But we came back to it. We didn't let it go. We moved forward, and we were able to complete it. Did we have barriers? Absolutely. Some good conversations, sometimes heated conversations when everybody has got different views and you've got a lot of people around the table, but we worked through them just one by one. Let's figure out exactly what the rules say. Let's figure out exactly how we can meet both of our needs, because it needs to be a win-win or it doesn't work. And so I think we were able to move forward really well going through that process.
Fantastic. And I have a question in the chat from Nancy about information that's pertinent for residents in Texas, especially related to dialogue and resident councils. I think it's a fantastic question. One thing we've been talking about in the coalition, we do a resident council pilot to help scale and strengthen resident councils currently focused in Connecticut. And something we've been talking about is there data resident councils should be looking at on a regular basis to sort of understand what's going on in their nursing homes and sort of be empowered in that work. And I guess I'm wondering, if you were a resident in a resident council in Texas and sort of trying to understand your nursing home, maybe the nursing homes around your nursing home better, what data would you look at that the state is making public? And, how would you kind of use that data?
Absolutely. And in Texas, we make a lot of data public. Long-term care regulation in Texas has an annual report that we post publicly that takes the year and it aggregates all the data across all the provider types that we regulate. Nursing home is one of them. It will tell you how many enforcement actions were taken. It will list who the enforcement actions were taken against. We also have a searchable search engine in Texas that you can look up a nursing facility and say, and it will tell you their last survey and what was there. We are very transparent about information, and I know other states are as well, about information that's available to residents, to everyone, about what's going on in the nursing homes in your state. And I encourage you to go look for that information, question the nursing facility. I saw this on the website. What does this mean? And tell me how you fixed it, basically. And so that and you're part of the solution with them.
Thank you. So we're getting close to the top of the hour. I want to thank you, Stephanie, for all the fantastic work you do in Texas. for sharing it with us here today on the Moving Forward Coalition conversation today. It's really important work, and I think we are so strong on in the coalition, which Alice really champions, and I've learned from her, is that these, seemingly smaller steps to get organized, to get people together, to have conversations about getting organized, to make sure you are using the same language, the same definitions, you're having the same conversation, are so foundational to all the other change that can happen to improve quality of care, right? It all really trickles down from there. And so just so grateful for you sharing your leadership in this one example of really doing that work. And hope you'll keep us posted on sort of the impacts and next steps as you go along. I'll say as well to folks on this call, if there's similar stuff happening in your state, please share it with us. We'd love to share it with our wider community and learn what you're doing and why it's working. These best practices are things that, we can keep spreading around the country. I will say that our next coalition conversation is on November 7th. At 3 p.m. Eastern time, and it will be on mental and behavioral health care in nursing homes, and looking at policy approaches to improve the quality of that care in nursing homes. So we're really speaking with a group of experts about their thinking and leadership on that topic, and hope you all will join us. You can register on our website, as you probably registered for this, and we'll also be posting about it. So with that, thank you all so much. Stephanie, I don't know if you have any final last words, but I will give the mic to you for the last words. Thank you for being here with us.
Well, once again, I appreciate you inviting me to share what we're doing in Texas. And if anyone wants to reach out, I believe I included my email on the PowerPoint. If I did not, please feel free to share it and reach out to me if you have any additional questions or just want to talk about what we're doing.
Thank you so much. And I will make sure to email the PDF of the slides and Stephanie's contact information with everybody via an email in the next, and along with the recording. So thanks all for joining.